Good afternoon, everyone. I thank you for joining us here today for a COVID-19 update. You will hear from Dr. Gail Berstein in a few minutes, and of course we're joined by Kendra Schmidt from Deaf Access Services to provide the American Sign Language. So thank you for joining us here today. We have a lot of information to go through since I presented last week. As of yesterday, we have 90,543 unique COVID-19 cases since the beginning of the pandemic. There were 109 new cases identified yesterday. These are new people. These are not repeats. And it's the highest total, one-day total, since May of, or the 14th of May. That brings our 7-day average to 591, or total 591 new cases in the last 7 days, which the average per 100,000 residents over 7 days is 64.3. So we are in the substantial risk of transmission under the CDC guidelines. We entered that last Friday, and we've been going up since then. Hospitalizations as of August 2nd, there were 40 patients in Erie County hospitals. 5 were in the ICU, 3 were on an airway assist, and the 40 patients is the highest, as you'll see in some time as we go through that data a little bit more in depth. The confirmed cases over the past 6 weeks, the week ending June 26th, we had 49 total cases in Erie County. As I noted yesterday, we had more than 100 cases that were confirmed. For the week ending July 31st, there were 535 new cases during that 7-day period. Total new cases have increased by 80% in the last 2 weeks. Weekly cases have increased tenfold since the week of June 26th. And as I noted, Erie County has moved into the substantial transmission designation per the CDC. It's not great. We're not as bad as other parts of the country, but like the rest of the country in New York State, we've seen a significant increase in cases in the last month. The level of county transmission for the week ending August 2nd, I showed this map last week, almost all of New York State was in the yellow with some blues. There was one orange and that I'm aware of downstate, and now as you see, the entire downstate area is mostly orange, and you have spotty sections in upstate New York that are orange, including Erie County. I talked about the upper Midwest and the Great Lakes and how we were doing so much better, and now you see a lot of that area, which was yellow and blue, is now orange, and even some reds. And then of course the Southeast, Texas and other parts of the West are just bad. More than 100 cases per 100,000 residents in a 7-day period. We see what's happening in the South. We've seen governors. I think the Arkansas governor today said they wish he hadn't signed the mask prohibition law because they need the mask wearing in Arkansas. It's pretty bad down there. I've heard reports from local hospitals that they've received calls from hospitals in the South seeking their ventilators because they don't have enough ventilators in the South. And while there's a lot of people who want to disregard what's going on in the country, it is real. The Delta variant, as we'll talk about, is bad. I probably shouldn't say it, but the Delta variant is badass. That's the best way to put it. It is not good. Much higher contagious levels, and they're still trying to figure out if you can get much more sick. But we do know that individuals who are vaccinated can catch COVID and can get sick, though not as bad as others who are unvaccinated. New cases for week ending July 31st. This is broken down by zip code. The highest number of cases in the zip code was 37 in the Amherst-Williamsville Clarence 14221. But if you broke it down based on the residents, the most cases was actually in the village of Springville, town of Concord, the 14141 zip code, which had the equivalent of 194.1 new cases in just a week. And we know a lot of that was directly related to a child care entity as well as a summer program. So we do know some younger individuals, and Dr. Gail will talk more about that later, who were contracting COVID, some of whom are sick, even though they're young of age. So we want people to understand that it is everywhere. It's in the city, it's in the rural areas. So the highest rate was Springville. The next highest rate based on the per capita number was the Buffalo East Side, 14215. You really can't get two different locations than Springville and then 14215 in the city of Buffalo. The next was Depew. Then you see Lancaster, you see Cheektowaga all rising. Not a big surprise. If you have Lancaster and Depew high, Cheektowaga is going to rise. So we are very concerned about the direction we're going in some of these communities. And in the vast majority of these cases, the individuals who are testing positive are unvaccinated. That's not to say you get 100% protection from infection if you're vaccinated. That is not the case. We've always known that not to be the case. But we know vaccines protect against serious illness and death. And as we'll talk about more, we've got the data to show that. But just because you're vaccinated doesn't mean you couldn't catch it. And you could get mild symptoms, and there are people in our community who are vaccinated who have received it and have had symptoms of fever and cough. It's just not enough to be hospitalized or serious illness. But the outbreaks are across the county, urban, suburban, rural. And if you look at those, suburban, Depew, urban, Buffalo, rural, Springville, the three highest based on per capita, so it continues to grow. As we know, we're seeing clusters in school settings, childcare settings, a couple summer program settings, including some camp, as well as seem to be getting a lot of individuals who traveled to the south recently and have come back and now find themselves sick, which is not totally surprising because there's very little mask wearing in those communities. The vaccination rates are much lower, and as we saw with regards to the community transmission rates, they are very high in the south. So Delta variant is here, but if you traveled south recently and you're not feeling all that great, get tested. If you just don't feel great, get tested. We'll talk more about how you can get tested. Confirmed case age group, last 7 days per 100,000. This is the same as last week. It's being driven by the 20 to 29 and 30 to 39-year-old category, though every age group has had COVID cases, and they have risen in every age group in the past few weeks. So the highest numbers are in the younger adult, including working age category, 20 to 29, 30 to 39, but we do have cases across the board in all age groups. And this is a little different than we saw about a couple months ago when we stopped having the press conferences, because we really saw a tremendous drop-off in the cases, especially over the age of 60. That's not necessarily the case anymore. We are seeing cases in people over the age of 60. And in the youth ages 17 and younger, it was more than double than the last week. So it went from 43 cases to 98 cases. Once again, just because you have a child, the child can catch COVID and get sick. And we are seeing cases nationwide of the pediatric ward of hospitals getting a lot of COVID patients. And Dr. Berstein will talk a little bit more about that as well. And we do know that if they're under the age of 12, they cannot get vaccinated. So if you have young children, you're going out in public, they should be wearing masks because they are at risk. They can catch COVID and they can get sick. Erie County hospitalizations from July 1st to August 2nd. We wanted to do a whole month rather than 2 weeks just to kind of show you how there was the slight decline through most of July. The low was on July 15th with 10 people in Erie County hospitals. I was hoping we'd get to 0. We didn't. Since then, the last 2 days we've had 40, so it's quadrupled in basically a 2-week period. And thankfully, the ICU cases are still fairly low. We have seen a couple deaths recently. We have seen an increase in the number of individuals on ventilators. Why are these numbers not higher like the rest of the country? Because we have a lot of people vaccinated. And the vaccine protects against serious illness, hospitalization, and death. So we are seeing cases. We are seeing people going to the hospital. I believe it's basically 90% of these individuals that are hospitalized were unvaccinated. The rest generally have health conditions that are serious, but we are aware of individuals who are vaccinated who have no underlying conditions who are hospitalized. We have heard those. Not a lot, but they exist. And then 55% of the COVID-19 hospitalizations are age 64 and under. It's not just young people. This is not just old people. It's not totally surprising that 55% of COVID-19 hospitalizations would be 64 and under, because in the age group of 65 and older, we have very high vaccination rates. We have very good vaccination rates between the ages of 50 and 64. We have pretty good vaccination rates under 50, but there's still a lot of people who haven't been vaccinated, and they are ending up in the hospital. and I'm hopeful that we don't lose any more people, but we've lost a lot of people in Erie County, including some recently. Hospitalization chart going all the way back to March. We think this is very important to see. Vaccines are working. We have lower hospital admissions than last spring, the winter, and this spring. You see the initial bump, and it dropped when we basically had the shutdowns, and it stayed that way through summer. And then we had the big increase in the fall and winter. Then it went down. Then you see the increase again at the end of March and April, and then it went down. And now is a slight increase. There is a slight increase. Thankfully, we're not like our fellow Americans down south where you'd see a big jump up in those hospitalization numbers. And the reason is because we have a very high percentage of our population that's vaccinated, especially those over the age of 65. Deaths. We did have 2 more deaths in the last week since we talked. And of the 192 reported deaths from April through July 29th, 95% were not fully vaccinated prior to infection. They may have had 1 dose, they may have had 0 doses, but they were not fully vaccinated. 5%, or 10 of those individuals since April, were fully vaccinated. It is our understanding that in almost every situation, the individuals had health issues and serious underlying conditions. And one of them was a friend of mine, as I've talked about, who was fully vaccinated but was going through cancer treatment. And there was a question as to whether or not the vaccine would work with his lower suppressed immune system. And unfortunately, it didn't. But it just goes to show that even fully vaccinated people can get sick, can be hospitalized, in some situations die. We've had 9 individuals die of COVID in the month of July. 1 was under the age of 40. 1 was in the age group 40 to 49, 1 50 to 59, 5 in the 70 to 79 age category. I really don't know why anybody over the age of 70, truthfully, I don't know why anybody over any age would not be vaccinated. But if you're in senior years and you haven't been vaccinated, you're basically playing Russian roulette. It's as simple as that. With the Delta variant, it's very bad. And the individuals who are dying, 95% of them since April, were unvaccinated, or not fully vaccinated is the best way to describe it. I can't say exactly how many had not received a dose of a 2-dose regimen and had gotten and completed it. So I'm going to turn it over to Dr. Gail Berstein to talk through a lot of other information and statistics. But the one thing I want to leave before I come back up later for the question and answer period is the Delta variant is serious. It is much more highly contagious. We know individuals can catch COVID-19, be infected by it, even if they're vaccinated and still have symptoms like a fever, like a cough, like the chills, as the doctor will talk about. If you're suffering any illness symptoms at all, please get tested. Even if you've been vaccinated, there's a chance you could have COVID-19. The numbers are escalating. They've quadrupled in basically a month. Actually, they've gone up 10 times in cases by a month. Our hospitalizations have quadrupled in a month. And we expect the hospitalizations to grow because the hospitalizations are a lagging indicator, which means first we get the cases, and then 10 days to 2 weeks afterwards, we get the hospitalizations. There are people who tested positive for COVID-19 yesterday who I guarantee will be in the hospital in the future. They're not there yet, but they probably will be there in the future. So we expect those numbers to go up. If you haven't been vaccinated, please get vaccinated. If you're not feeling well, as the doctor will go through in greater detail, please get tested. It's very important that you know if you have COVID-19 or not, because if you have it, even if you have mild symptoms, you may be able to spread it to others. And then we just keep the cycle of growth going. So with that, Dr. Berstein.
Hi, good afternoon. So first I'm going to talk about, as the county executive said, one of our most critical strategies to preventing transmission of COVID-19 in our community, and that is getting tested. Even if you've been vaccinated, it's essential that you get tested to know your status. If you've had any symptoms, or if you've traveled, especially to areas of the South where we know that there's a lot of COVID-19, or if you've been identified as a close contact to COVID-19. It's recommended now that you get tested if you've been exposed or if you've recently traveled 3 to 5 days after your exposure. It used to be 5 to 7 days, but because of the Delta variant we know is here and we know is the most common strain in Erie County, it multiplies very, very rapidly. And so we're able to detect it in 3 to 5 days instead of 5 to 7 days with the other variant strains. So if we are still in Erie County Health Department offering free COVID-19 testing, you can call again at 858-2929. We're offering diagnostic PCR testing, and we're also that the results are going to be available 1 to 3 days. And then we're also offering point of care, the rapid testing, that the results are available on site. So please get tested, knowing your status. This is a key strategy to getting rid of ending transmission in Erie County. So we know that Monday there are going to be many U.S. Residents and citizens who are going to be anxious to get across the border to go to Canada. So we know that you're going to need a test to get over there. So in Erie County, we are going to be offering testing for people who want to travel to Canada. So starting this Friday, you'll be able to call and make an appointment to get a test this coming Monday. So again, we're offering rapid testing, and we're offering the type of rapid testing that will make you eligible, if you're negative, to get across the border. So again, give us a call at 858-2929 on Friday if you want a test on Monday. Just some updates on our vaccination numbers. We're doing better. We're inching up very, very slowly each week. And so we're hoping, we can get to those higher numbers before school year starts. So just as of August 2nd, almost 61% of all Erie County residents, and so that includes people that are too young to be vaccinated. So, but looking as a population, almost 61% of Erie County residents have received at least one dose of COVID-19 vaccine. So, and that accounts for, breaking it up into the demographics, about 72% of all Erie County residents 18 and up, about 52% of the 16 and 17-year-olds, and about 45% of the 12 to 15-year-olds. So the younger age groups being less vaccinated compared to the adults is very concerning to me. We know that school is on the horizon, very close to the horizon, and we want kids to stay in school. And so vaccination is a key component to that. Actually, the CDC at the end of last week came out with a report showing the safety of the Pfizer vaccine in children. The side effects were almost all very, very mild, and the Pfizer vaccine is safe. I make sure that my children have been fully vaccinated, and I hope parents, you'll talk to your pediatrician and get your kids vaccinated. Most pediatricians in our community are offering the COVID-19 vaccine in their offices, so please talk to your pediatrician. And then looking at the Erie County residents who are fully vaccinated, we have 57% of all Erie County residents are fully vaccinated. So let's try to get that number up higher. So we are trying very hard in Erie County to help people get vaccinated. We are going out in the community with mobile teams, working with our community health workers to go out to communities where we know that there are low vaccination rates, and have people just walk outside and come and get a vaccine. We want to go to where the people are. Also, we are still offering our vax visits at home. All you have to do is call 858-2929, and we work with a home nursing agency, and we will send them out immediately, or as soon as they can get to it, to vaccinate you in your own home, and there is no cost to you. Also, we are trying to get out in the community where people are already. So today, we're going to be at the East Aurora Boys and Girls Clubs and the West Side Community Services. In 2 days' time, we're going to be at the Johnny B. Wiley Sports Pavilion. This weekend, we're going to be at the Hamburg Village Community Market, and then we are going to be at the Erie County Fair. So just want to say something about the fair. I know that you all are going to go to those food vendors and eat some food that is like fried and not good for you. So if you want to do something healthy at the fair and you're not vaccinated, come and see us at our Erie County Health Department. We have a big mobile clinic outside, and we can vaccinate you. So do something healthy at the fair. It doesn't have to be all fun and food. You can do something healthy. So please, if you're not vaccinated, come and see us. And you can look at online at our website to look for our vaccine schedule, or call us at 858-2929. We always accept walk-ups. I just want to now talk about what we're seeing in the schools and the summer camps, which is very, very concerning. In July, we have seen more evidence of transmission in the summer schools and the camps than compared to what we saw during the school year. So far, just in the month of July, we've had 39 cases that have been reported that have been associated with either a summer school or summer camp, both in staff and in campers or students. And so we are very concerned. We know what works. We know how to prevent this. Even before we had vaccine, we were able to control the cases in the school. And unfortunately, many of the summer school programs and many of the camps are not adhering to these guidelines that we know what works. So what we're seeing in these summer programs is that there's unvaccinated staff, and many of them are not masking. They're not cohorting. They're not just staying in one group. And also, staff and campers and students are coming in to camp or school when they're sick. When you have symptoms, you have to stay home. This is why we're seeing transmission. Also, we know there were students and staff and campers, are not masking. Now with the COVID-19 Delta variant, that is so high. It's more than twice as transmissible as the other variants that we've had, the other strains that we've had here. It's really important that people mask. Also, when kids are in school or in the summer camp programs, the camps or the schools aren't keeping track about what room they're in or what seat they're in, and so we can't assume who is a close contact, and we'll have to assume everybody in the group is a close contact if we don't know who was within 6 feet for 10 minutes or more. And so again, that's not allowing the kids who weren't potentially really close contacts to participate in camp or summer school. Also, we're seeing that staff are working in multiple rooms, and so if a staff is infected and they're going from room to room, they're infecting other people. So we are anticipating that the New York State Health Department will hopefully, before school begins, issue guidance for grades K through 12 schools. So we're waiting for that. The New York State Education Department has recently issued guidance to schools to follow CDC guidance for masking, social distancing, and testing. And then we are also working with all the school districts to offer them screening testing during the school year to help keep the schools open. We want the schools to be open, and we are doing everything we can to work with the schools to make that happen. So now I want to move over to the Delta variant, which is, the county executive said, is something that is causing us a lot of problems in Erie County. We had a great little holiday earlier in the summer where we were seeing very few cases, very little transmission, and now it's blown up. We are seeing a transmission again in Erie County because the Delta variant is here. We're seeing it in adults and we're seeing it in children, and this has been well documented. We know, the Delta variant is more than twice as contagious as the original COVID-19 strains that we've seen in the United States, including Erie County. There is evidence that it can cause some more severe disease compared to the other strains, but the dust hasn't settled on that. And also, we're seeing transmission even from fully vaccinated people. So again, the vaccine is very protective against preventing moderate to severe disease, hospitalization, and death. However, it may not protect you as well from infection, just like the flu vaccine. So it's still important that we take other preventive measures. Remember, it's the multi-strategies to prevent infection and transmission. So what we're recommending is, people, still adhere to masking. Masking works. It masked when we didn't have any vaccines. It's going to work now. And also doing more outside compared to inside, especially since the weather's warm. Try to distance. Stay away from people when you're sick and get a test. So these are graphs that we pulled from the New York Times that was published this weekend, looking at COVID-19 reported cases in areas that have high vaccination rates on the left and in counties that have low vaccination rates on the right. So these graphs are looking at the cases per 100,000 residents from May 1st to July 29th. So you can see on the left where in the areas and the counties where they have high vaccination rates, that over the summer, the numbers of reported COVID-19 cases really dropped. And then during July, when the Delta variant came into our communities, we did start to see an increase. However, the increase of reported COVID-19 cases is nowhere near the number of cases that we see on the right, where in the areas that have not been fully vaccinated. So vaccine does work. It is protective, and it is an essential component of getting out of this pandemic. And then this is looking at similar data, but looking at the end game, preventing deaths. So this is again from the New York Times, from this weekend's publication, looking at deaths from COVID-19 in areas that have high vaccination rates on the left, and then in areas that have low vaccination rates on the right, and looking at the number of reported deaths per million residents from May 1st through July 29th. So you can see on the left-hand side, although the rate of decline of number of deaths from COVID-19 has flattened out, it hasn't significantly increased. Whereas on the right, in areas where they have low vaccination rates, they did see a small decrease in the summer. However, they have seen a substantial increase again. So again, COVID-19 vaccine is highly protective of preventing deaths, severe and moderate illness, and hospitalizations. So it's critical that everybody who is eligible to get vaccinated gets vaccinated. So just want to talk about, again, the vaccine effectiveness. We have data in Erie County, as our county executive alluded to, that we know the vaccine is protective. There are very few people who are hospitalized with COVID-19 in our Erie County hospitals that have been fully vaccinated, and those who have had many comorbidities that renders their immune system not very functional, and so they have a difficult time mounting an antibody response and fighting infection. However, we know the COVID vaccine is protecting most of Erie County residents who've been vaccinated from getting hospitalized. And then the end game, which is very sad with deaths. So we've been tracking of our Erie County deaths related to COVID-19 since April, and so far 95% of our Erie County victims of COVID-19 were not fully vaccinated. So again, COVID-19 vaccine is very protective. So questions and answers, I'm going to turn over to the county executive. I just want to put in one plug for pregnant females. We know in our community, pregnant females have a very low vaccination rate. We also know that actually an article that was just published in this week's JAMA Pediatrics show that females who are pregnant who develop COVID-19 can develop some severe complications and adverse outcomes to the pregnancy and for the newborn. So it is critical for pregnant women to get vaccinated. Ask your OB if they have a vaccine. If they don't, which they can, because we are giving vaccine to any Erie County medical office who wants it. But if they don't, ask where you can get it in a pharmacy. This is critical to keep the pregnancy healthy. So I'm going to turn it over to the county executive. Thank you.
Thank you, Doctor. We will take on-topic questions first. I know there's going to be some off-topic questions. And if you could, please identify yourself and name the organization you're in, because truthfully, there's some of you I've never met before. Let me go back there first.
I'm Brianne with Spectrum News. Are we facing another shutdown?
I do not. The question was, are we facing another shutdown? I do not think we are facing another shutdown, primarily because our vaccination rates are very high. But the biggest thing that we're asking and we're requiring in county buildings, all the reporters and cameramen and others are wearing their masks. And we are asking for private entities to require masks for people when they're indoors. The CDC has recommended it for anyone indoors in a public setting. If you're in a substantial risk of community transmission or higher, the highest risk, we are requiring it in county buildings. I know, like I just saw, I think a couple of colleges are requiring it. for their faculty, staff, and others, even though they're requiring everyone to be vaccinated. The city of Buffalo is requiring it, and we need the private sector to do it too. You will protect individuals if you're wearing masks. So if we continue to be smart, get high vaccination rates, people wear masks indoors, or when they cannot otherwise safely socially distance, then I think we're going to be okay and we won't have to worry about lockdowns. Michael?
Mark, just wondering what sort of threshold it would take for you to want to expand any kind of restrictions. I know private businesses right now can make their own choice, you're recommending, but at what point would you mandate that these private businesses do anything? Is there a specific number you're looking at?
The question is, what point do we mandate requiring private businesses to have everyone wear masks inside? I don't have a specific number. It's going to depend on cases as well as hospitalizations. So we're not going to say that you hit this mark and then that's it. Because if you hit the mark in cases, but you have low hospitalizations, maybe it's not necessary. If all of a sudden we have a tremendous amount of new hospitalizations like they do down south, then it would be something I'd be concerned about. Right here first.
Kayla from News 4. We saw New York City yesterday announce they're requiring vaccination for restaurants, gyms, other public spaces. Is that something you're considering at this point, or what would lead to you to consider that if not?
Well, if I haven't mandated masks yet, I'm not going to mandate vaccines. New York City required, as of yesterday, everyone to be vaccinated for gyms, restaurants, like theater. We're not at that point yet. New York City is a much more dense community, so it's easier for transmission. We know what they went through. They went through hell. They lost a lot of people. I'm not surprised that the mayor did it, but I don't think we're in that position yet. And before I would mandate vaccinations for private establishments indoors, we would mandate mask wearing. Yes.
Olivia from WQEW. You mentioned briefly that some hospitals in the South are asking Western New York hospitals to send them ventilators. Can you tell me a little bit more about it? Like what hospitals here have been asked to send ventilators where, and are they going to?
I don't believe any. The question is what hospitals have been asked to send ventilators down south. I have heard that from a couple of the hospital system and representatives. I would suggest you contact them, but I don't believe any hospital system at this point is sending a lot of ventilators. They may be sending some because we haven't really needed them. Our ICU numbers are very, very low, but I would leave it up to the hospitals to answer if they've actually sent anything out. Jeff?
New Jersey. Based off of the current track in the data, we know that we're in substantial, but based off the current track, and we know that behavior out there could certainly change things, but do you have any idea as to when Erie County could possibly hit high transmission? Have you been doing any forecasting on that?
The question is, have we been forecasting with regards to when Erie County would high transmission? We've done some internal looking at it. It changes every day. We jumped up into the 50 category on Friday, and right now we're at 64. We seem to have leveled off a little bit, but every day is different. I mean, one day you could get 60 cases, the next day, as we hit today, we had over 100 cases. So we are seeing growth. And I don't want to speculate and say, here's the date in which we are going to hit the high community transmission point, because it is speculation. Last Tuesday, I said I thought if we continued on the trend line we were seeing, we'd hit the substantial risk category on Saturday, and we ended up hitting it on Friday. But we were really seeing a upward trend over a 4-day period that was pretty marked. We sort of kind of saw that trend, and it sort of leveled off a little bit. I don't have an exact date. I'm hopeful we don't hit the high category. And the best way to do that is for people to act appropriately and wear masks when they're in a situation where they're indoors and or otherwise can't safely socially distance. I don't have a particular date. We've looked at it, and it's too far out in advance to say that this is when we think it would happen. Because if we have a few days of low transmission, low cases, then that would evidently affect our 7-day numbers and hopefully go down. I'd much rather see us go down than continue to go up. Question on topic?
Yes. Could you explain your decision last week to implement just the county building mask mandates? There's criticism from Mickey Kearns the other day saying, why make it all mask everywhere? or no mask everywhere? He wants it to be universal. How come you made that decision last week?
We based it on the CDC findings and determined that we were not going to impose it on every entity in the community. It's kind of funny, I haven't heard boo from the clerk since basically before COVID, and now he's critical. I don't know, is he recommending that we impose it for everything? I don't think he is. It's just interesting that he issued the letter. We follow CDC guidance, and the CDC guidance was recommended mask wearing. It didn't say mandatory mask wearing, it said recommended mask wearing, so we did it internally. And we recommended and highly recommended for all private entities in indoor facilities. And I'm glad I heard the clerk did follow it and is requiring mask wearing from all invitees, guests, as well as employees, because that's going to prevent the spread in our buildings. And I would hope that others would do it too. As I said, if we continue to see cases rise, hospitalization rise, then I would consider imposing a mask mandate for indoor and all public facilities. We're just not at that point yet. We have seen growth. The growth has not stabilized, but it's not growing at the same rate as it was a week and a half ago, a week ago. So maybe people are taking it seriously now, seeing what's happening across the country. More people are getting vaccinated, and I do think more people are wearing masks in the last week than they were 3 or 4 weeks ago. It's quite evident. Any other questions on topic?
Can you mandate masks?
Yes, I can mandate masks indoors. I have power under public officers law. There is still a state of emergency in Erie County. We've never rescinded the state of emergency. The state of emergency was kept in effect so we could do certain things with regards to testing as well as vaccine delivery. So the state of emergency still exists in Erie County, and under the public officers law of New York State, I do have the power to mandate indoor mask wearing in private settings. And the governor's even said that. Governors come out publicly and talked about how the counties do have that power. We have the power. What happened last year is the state Assembly and Senate passed a law giving the governor power in which it said he overrides the counties and the local health departments. He sets the standard. That law has since been revoked. It's expired, and he has not issued another state of emergency. Under New York State law, the counties and the county health departments have the power to impose mask mandates, just as we have the power to impose someone going into quarantine and isolation, issuing quarantine orders, requiring an individual to go in quarantine, and if they refuse to do it, actually sending the sheriffs out there and say, you're coming with us. You're a public health risk. And that has happened on occasion, but most people follow the quarantine orders when they get them. But we do have the power under New York State law.
Can cities, towns, and villages make their own rules?
Cities, towns, and villages, can they make their own rules? The answer is it's different because they do not have health departments. I think they could declare a state of emergency and say in our town we're doing this, but they don't have the health department to back it up like we do. No cities, not even the city of Buffalo, has a health department. There's only one health department among municipalities in this community, and that's Erie County. The New York State has a health department, but it doesn't follow the same kind of work guidelines and requirements that we do. So cities, towns, and villages, theoretically, if they have a state of emergency, they could impose certain orders under New York State, but it'd be tough for them to enforce them without having the health department behind them like we do.
So it's a credibility thing. If, say, Erie, for example, just throwing out a local town, if they said, hey, you don't have to wear a mask, well, they have no health department that can basically provide health professional opinion. Is that, am I understanding?
Well, the question was if a hypothetical town, let's not use a town that exists in our, let's say Washington. Let's say the town of Washington, which does not exist in Erie County, and the supervisor of the town of Washington, or the village of Lincoln, did it. Yes, they theoretically could, and they'd have to rely on their police department to enforce it, as compared to having a health department enforce it. Yes.
I just wanted to clarify something about the schools. I know one of you said you're waiting on the state for those guidance. Will that definitely be blanket across the state, or could that be given up to the localities?
The question was, we're waiting for the state to issue guidance with regards to schools. Will that be blanket across the state, or will it be allowed to localities? We've been told the state is working on something. If they do not, we do have the power under the same law I just talked about to enforce it for schools. Remember last year, when the schools didn't know what to do, they were asking me to shut them down. And one of my first emergency orders was the shutdown of schools for I think a 2-day period, and then it extended to permanent. So I do have the power to impose universal masking in schools, especially if I had the power to shut them down.
And as a follow-up to that, I mean, I think you said you're concerned with the vaccination rate with that age group. I mean, what would cause you to possibly impose the masking? I mean, if it stays like this, would you?
Well, the question, what would cause us to impose the masking, and the answer to that is we'll see what happens. First off, I want to see what New York State does. New York State Department of Health, New York State Education Department. If they issue a blanket for New York State, we're done. Remember, the CDC recommended that everyone in schools, regardless of their vaccination status, wear a mask. And it would not shock me to see New York State issue that as a blanket rule for all of the state. If they do not, it is something I would consider here based on our current situation and the knowledge that anyone under the age of 12 cannot get vaccinated. And so all children in school, whether it's pre-K to when they're 11 years old, are at risk. 5th grade, I think that is, or so, are at risk of catching COVID, and they have no natural defense because they're not vaccinated.
Generally speaking, on the mask recommendation, do you get the sense that there are a lot of businesses out there that have implemented or offered the recommendation, a lot of entities out there, or is it tough to tell?
The question was, are there a lot of businesses out there that have implemented their own mask requirements? It's kind of tough to tell. We have to send our folks in. We can't force them at this point because we haven't done a mandate, but if we send an inspector in to check on just the health and safety rules associated with the bar or restaurant, they may have it, they may not. We do know some restaurants have required it locally. Most larger establishments have not done that. I saw McDonald's just announced if you want to enter a McDonald's, you have to wear a mask nationwide. Some of the larger chains like Target and Walmart have not done that yet, but they're highly recommending people who are unvaccinated wear masks. I would hope that they would just require it in all, is what you're seeing across the country. We don't mandate it yet. If I have to, I'll issue that order, and then we'll hopefully have 100% compliance.
And then real quickly, looking ahead to Friday, knowing that the 72-hour window starts for the test with the border opening, do you get the sense that there's going to be an onslaught of people who are trying to get those tests? Have you gotten a lot of calls, a lot of inquiries about getting a test? And then secondly, are you going to put more staffing to field those calls and field those tests?
The question is in regards to what we expect to be increased calls for testing for those who want to travel to Canada. And have we put increased staff on? The answer to number 2 is yes, we do. We're going to have increased staff doing testing. And we are anticipating increased calls. There are other locations outside of Erie County government where you can get tested. There's many other locations. The one thing I will note, I don't know if the doctor said it, it was in the slide, you have to be vaccinated to cross the border and have a negative test. If you are unvaccinated, even if you have a negative test, they will not allow you across the border. You'll get turned around. So you have to have proof of vaccination, and you have to have a negative test within that certain hour time period. You can call 858-2929, effective on Friday, to schedule the test so that you can cross the border effective on August 9th if you're vaccinated and you test negative. Off topic, go to you, John, first.
Thank you. John Worrell with the Associated Press. How serious do you take concerns of the potential of the bills relocating?
The question is, how serious do I take concerns about the bills relocating? First off, there's been a lot of speculation in the last week, especially, including reports in the press, about the ongoing negotiations between the Buffalo Bills, the County of Erie, and the State of New York. And I want to say, as someone who's involved in those negotiations, some of the reports and the information contained therein were false. Some of it was true. I don't go into the specifics associated with where we are in a particular negotiation, but it does not help the matter when there's all these individuals who claim to have knowledge about what's going on, speaking to individuals, and then there's reports about it. And it didn't help matters, let's put it that way. I don't want to go into the particulars of where we are in the negotiations and something like that, but I will note for the record, at no time has the team representative said, if you do not build this and pay for it, we are moving. They have not said that. And I want the public to understand there's been no gun put to the head of Erie County and New York State stating, if you do not do this, we are moving. And I want people to understand negotiations are a long process. The last lease, we actually, in some ways, started the discussion before I was sworn in as county executive, but after I won the election in 2011. It took us the whole year to get a deal announced, which we announced in December. We didn't close the deal until May of 2013, at which time it had fallen apart between December and May. I do not expect there to be an announcement of a deal anytime soon. There are conversations going on. But I do want to put out for the record, because there's been all kinds of speculation, including throwing out the name of Austin. There was no statement by the Bills, we're going to Austin. There's no statement by the Bills saying, we're going to San Antonio. There's been no statement by the Bills saying, if you do not give us what we want, we're leaving town. And I just would leave it at that, because it does not help when you have all this speculation going on. And I read a story, I think it was Saturday night I read the story, it was in Sunday's paper, and reading it and go, and reading parts and go, I know that's not true, because I've been in the meetings. And people with knowledge, well, I don't know who the people with knowledge are, but there's all kinds of speculation out there. And I will note that it doesn't help in trying to reach an agreement when there's all these people who claim to have knowledge about what's going on, talking about the situation, and the information is not accurate. So for the record, I did want to put out there that there has been no gun to the head of the county or the state saying, if you do not do this, we are moving. A negotiation takes time. It takes compromise on both sides. And my goal is to get a deal done that's fair for all parties. Bills fans, to ensure that Bills are playing in Buffalo, but also the citizens of Erie County. There is no blank check. There will hopefully be a compromise in which we all come together one way or another and do what's best for this community and ensure the integrity of the football team as the Buffalo Bills for decades to come.
Mark, just as a follow-up, is there any concern that what the issues that are affecting Albany and the governor, might that present some kind of a challenge when it comes to delaying or hiccuping discussions?
Question was, what's going on in Albany and the governor, would that potentially challenge the negotiations and the discussions? I will note this, the governor's not been involved in any of the meetings. My understanding, he's been made aware by the state officials of the conversations that have been ongoing, but he has not been involved in the direct meetings. There are other individuals that have. The state hired a firm, a law firm, to help them with negotiations. The state has also hired another firm to do consulting work for the next year and a half or so associated with the negotiations. So the state has taken action to bring in outside counsel and outside consultants to help them. We have outside counsel in Erie County. We have not hired outside consultants because we have a lot of the information we feel is necessary. But I do feel confident that the players in place right now can still move ahead regardless of what's happening in Albany. But it is a concern because, as we all know, the report from the Attorney General's office came out yesterday. It was a very damning report. I previously had said, let's not jump to conclusions with regards to the potential merits of any claims. Everyone's entitled to their due process. The report was very, very thorough, exhaustive. Attorney General's office said it was corroborated with witnesses. And I, like others, called for the governor to resign. If the governor resigned, our governor is then Kathy Hochul. And I do know Kathy Hochul wants to ensure that the Bills stay in Buffalo. Jeff, and then Olivia.
On the governor, course, we know that you called on him to resign, but is this an administration that you can no longer work with, given the circumstances?
The question is, this administration I can no longer work with? Well, you have to work with the governor's office. And as I say, I haven't talked to the governor in quite some time. I have talked to his staff. They still have plenty of power and plenty of ability. And so we continue to work with our partners, whether it's our partners that we're dealing with in the Bills lease negotiation or our partners dealing with COVID. So that will continue. If there's one thing I've learned in government is that government continues no matter who's at the top. Because there are good workers, civil servants and the rest, partners in higher levels of government that are still there to do the work regardless of what happens with whose name is on the plate at the top as governor. That's just how it goes in this business. Olivia.
What are your thoughts on Kathy Hochul in the governor role? Is that good for Western New York?
The question is, what are my thoughts of Kathy Hochul on the governor role? I think it's a little premature to say that because she is the lieutenant governor. She's not the governor. I have great respect for Kathy. I've known her for quite some time. She was a colleague of mine when I was county controller. She was county clerk. Of course, she was in Congress, lieutenant governor. I know she could easily step into the role of governor. And I think it's fair to say that if that did happen, we certainly would have a friend in Albany, no matter what we're talking about, regardless of the Buffalo Bills or any other matter. Thomas in the back end.
Regarding the AG report, it mentions that Vaccines are Larry Schwartz had calls with various county executives, including County Executive number 1, with implicit threats about a bit of a quid pro quo linking back access to loyalty to the government, to the governor, excuse me. You spoke with investigators in late March. Are you County Executive number 1?
The question was in the report from the Attorney General's office. It talks about how Larry Schwartz, the Vaccines Czar, had made implicit threats with regards to delivery of vaccine unless you supported the governor, and there's a reference to County Executive 1. I am not County Executive 1 because that is not what happened with me. If it happened with another county executive, I can't say. But when it came to me, I think I've been pretty forthright to the public. I actually announced my conversation with Larry Schwartz before I was even interviewed by the Attorney General's office and read a statement about what had happened. I knew Larry Schwartz from before. It's not like the first time I ever heard of Larry Schwartz or met him or talked to him was during the issues associated with the vaccine delivery. And I can be very upfront and frank with Larry, just like I could be with a lot of others in the governor's staff, because I've known them for a while. And I'm the one who brought up the governor's issues with regards to the sexual harassment claims, not Larry Schwartz. And he did not at any time implicitly threaten that vaccines would be withheld if I didn't offer strong support for the governor to me. No, I am not County Executive number 1. I don't know who that is, but it wasn't me. Michael.
Just to follow up on the Bill's questioning that was just happening, just it doesn't matter if the governor Cuomo resigns or if he stays on, it won't impact negotiations in your mind?
The question was if the governor resigns or stays on, it won't impact negotiations. No, I don't believe it will impact negotiations. The negotiations have to continue regardless of who's county executive or governor, because we have a lease that's expiring in 2023, and we want to ensure that we enter into a deal that is good for all, is fair for all, but that we have certainty. Now, do we need to get a deal done in the next 30 days? No. Do we need to get a deal done by the end of summer, the beginning of the first football game, which actually I guess is 30 days, just about? No. Would I like to have a deal done by the end of the season? Yes, of course. But I also said that last time, and it took a lot longer than I hoped for. I remember I had said early on in 2012, I want to get a deal done by training camp. And then I said, I want to get a deal done by the first game. And I was like, I just want to get a deal done. I have no arbitrary deadline. We will get a deal done. Doesn't matter if it takes 3 months, whatever. But we will get a deal done. It's just got to be a fair deal for all. If there's no further questions, I thank the reporters who are here. I thank them for being masked, as well as our staff that's here that's assisting. It is 5 minutes to 2. We've been doing this for approximately 55 minutes. I want to thank everybody. I want to remind everybody that Delta variant is very bad, twice as much transmission. You know what I said earlier. It is bad. And the other thing, I'm probably going to get scolded for saying that, but be safe. If you're not vaccinated, please get vaccinated. Don't play Russian roulette. There's individuals out there that we're seeing where now stories nationwide contacted family members while they're in the hospital ICU saying, I wish I got vaccinated, and then they die. We had a story of a young child die not too long ago, not from us, not our region, but elsewhere. The parents were like, couldn't believe it. But that child couldn't get vaccinated and caught it from a family member. So do your best. Get vaccinated if you're not vaccinated. Wear your mask when you're indoors. It really makes a difference. If you're the only one wearing a mask indoors, don't be embarrassed by it. Be proud. I did that in an event a couple days ago. I was indoors. I was the only one wearing a mask. And people were looking at me saying, you're vaccinated. Why are you wearing a mask? And it's because COVID-19 Delta variant is very, very strong. And just because you're vaccinated does not mean that you can't catch it and get sick. And truthfully, I don't want to get sick. It's summer. Last thing I want to do is lose 2 weeks sick, having to quarantine with a fever and a cough. So why would I want to get sick? Mask up. Protect yourselves, protect your family, protect your community. Do it for our country, and we'll get back to whatever the new normal will be a lot sooner than it is right now. Take care. Be safe and well, everyone.